3 or 4 out of every 10 people with diabetes have signs of diabetic retinopathy. Many of them don't even know it. Are you one of those 3 or 4? If you have diabetes, you may be slowly losing your eyesight, so slowly that you have not noticed changes to your vision. But that does not mean that your eyesight is safe. Diabetic retinopathy is the #1 cause of blindness among adults in America. What is diabetic retinopathy? Let's first look at a healthy eye. In a healthy eye, small vessels deliver blood to the retina. The blood contains nutrients and oxygen, which are required to keep the retina healthy. The retina is important because it sends signals to the brain, and those signals become the images that we see. For people with diabetes, excess sugar in the blood can damage delicate blood vessels, even if the diabetes is well controlled with diet or medication. The vessels can become swollen, or they can leak blood or fluid. The vessels can also close off entirely, and sometimes new blood vessels form. As diabetic retinopathy develops, it can cause swelling in a small part of the retina called the macula. The macula is important for sharp vision. But swelling in the macula, or macular edema, can make it hard to read, recognize faces, drive, and remain independent. For people with diabetes, macular edema is the most common cause of vision loss. This is why it is important to get screened. Screening for diabetic retinopathy can catch the problem while it is still treatable. People with diabetes who receive regular screenings have a 90% chance of keeping their vision. Do not wait. Get screened today. Screening is quick, simple, and painless, and it can save your vision. At the University of Florida, we bring the screening to you, in the same office where you see your primary care provider. The entire exam takes about 5 to 10 minutes. We use a special camera that has artificial intelligence. First, you will be asked to sit in the dark to allow your eyes to naturally dilate. Next, you will place your head on the chin rest. The camera will then take 4 pictures of your eyes. There will be a painless flash of light with each picture. After the images are obtained, the camera's artificial intelligence diagnostic system will check for diabetic retinopathy and/or macular edema and provide the diagnosis to your provider. That is it. There is no pain or discomfort. There are no drops to dilate your pupils. Note the camera is very sensitive and can pick up retinopathy at the very early stages, even before treatment may be recommended. We just may need to keep a closer look at your eyes with more frequent screenings. We will also give your eyes a second look. We send all of the photographs over our secure network to an ophthalmologist. Your privacy is respected. You do not have to worry about anyone else seeing the pictures of your eyes. The ophthalmologist will review the pictures, usually within a few days. If the ophthalmologist notices any changes to the blood vessels, you will be notified, and you may need more tests. If you do have diabetic retinopathy, treatment can help keep it from getting worse. And remember, routine screening in people with diabetes can reduce blindness by 90%. Note that these special pictures do not take the place of a complete eye exam. They only look for diseases that affect the retina, but they may save your eyesight, so you can continue to do the things that you enjoy. Screening for diabetic retinopathy is quick, simple, and painless, and it may save your eyesight.